Hello everyone, this is Kevin Young presenting a case study on an infectious disease of childhood, specifically mononucleosis. So, a 17-year-old high school student has a severe sore throat and a fever for the past 3 days that apparently is not getting any better. His temperature is 102 and his tonsils were very large with exudate on them, probably pus. His lymph nodes are tender and his liver and spleen are enlarged. His blood showed increased white blood cells and atypical looking lymphocytes. At this point, the primary care provider is already thinking mononucleosis. So, a rapid heterophil antibody test was ordered and came back positive. It looks like our guy has mono. You may be asking, how did we come to this conclusion? Well, let's discuss the way mono infects and it affects the body. A research article from St. John's University discusses the pathophysiology of mononucleosis. It starts when the patient is infected with the Epstein-Barr virus, which is actually a herpes virus that is transmitted through saliva. The virus mainly infects the back of the throat and tonsils, which is why our patient had such enlarged tonsils. The virus then infects B lymphocytes, causing them to multiply and secrete specific antigens or cell markers specific to the Epstein-Barr virus. These antigens can actually be detected by a heterophil antibody test, which is one of the key diagnosing factors for mononucleosis. The B lymphocytes also become atypically large, as we see in our patient's lymphocytes. T cells and natural killer cells respond to this invasion of the Epstein-Barr virus through the cellular-mediated immune response, causing all of the symptoms that are typically present with mononucleosis. These symptoms are fever, enlarged or tender lymph nodes and tonsils, enlarged spleen and liver, and also fatigue or malaise, where you just feel weak. These enlarged spleen and liver are due to the proliferation or rapid increase in the number of T cells. In an article that was published in the British Journal of Hospital Medicine, they detail a case study of a patient who presented to the emergency room with a ruptured spleen, following about 2 weeks of flu-like symptoms. After the successful removal of the spleen, they found out that the patient had a positive antibody test for the Epstein-Barr virus, and then diagnosed the patient with mononucleosis. Splenic ruptures are one of the most serious complications of mononucleosis and should be taken very seriously by both the provider and the patient. The general recommendation is for the patient to abstain from contact sports for 8 weeks because most often splenic ruptures in patients occur from trauma. This picture shows what a positive and negative result to the heterophil antibody test looks like. The antibodies associated with the Epstein-Barr virus are actually recognized by horse's blood or sheep's blood. The petri dish on the right shows agglutination, which means the horse or sheep's blood that they used reacted to the antigen from the patient by clumping or grouping together. Now this process may take time, sending blood to the lab and having them prepare the samples and proper technique, and a lot of steps are involved. Nowadays you can avoid all of that by having a monospot test. This is done, which results in minutes, and are positive in up to 40% of patients during the first week of illness, but after the first week it's positive up to 90% of the patients. If the patient presents with all of the classic symptoms discussed before, but the heterophil antibody test is negative, then immunofluorescence assay test can be completed, and this is 95 to 99% accurate. So, what do we do with this patient? The treatment is supportive care, meaning that we're just helping the patient feel as good as possible while they fight off this infection. This patient was given an analgesic such as ibuprofen or possibly aspirin, and an antipyretic like Tylenol to help lower the fever. It is important to note that with rest, the patient should drink plenty of water and have good nutrition to help fight off the virus. It is also important to note that antibiotics are not prescribed. Why? Because this is a viral disease, and antibiotics will not help. We do not want to create any more superbugs like MRSA by overprescribing antibiotics. So what is the outcome for our patient? Over the next 2 weeks, his sore throat, fever, lymphadenopathy resolved. He returned to school, slowly regaining his strength over the next 3 months. One of the most frequently asked questions is, when can my child go back to school? Which is closely related to how contagious is this virus. The first question was answered by Dr. Mass, an associate professor of pediatric medicine at Louisiana State University. In an article he published, he said that mononucleosis does not require a student to stay home from school, but only to abstain from contact sports, as we discussed before. However, this does not mean that mono is not contagious. We discussed earlier that mono is spread through saliva, which you would think would cause the virus to be spread fairly rapidly. But a study at the University of Minnesota determined that the main risk factor that linked most of the infections was kissing. More specifically, deep kissing. So as long as your child is not making out with anybody, they should be okay. As an additive, I would suggest avoiding taking drinks from the same bottles and eating the same food as someone else. This is just a suggestion. Thank you.